Hi, I'm Chris Duncan, and I'm a licensed independent insurance broker, and I run a company here in Temecula called Trusted Benefits Direct. And it's such a beautiful day, I decided to make our video out here in front of City Hall and tell you a little bit about who we are. And what we are is we're an independent insurance agency, and we specialize in helping seniors with their Medicare options, helping those that are already on Medicare, those that are turning 65, coming on to Medicare, or maybe those that have had a disability and are now getting Medicare. And it's also important to note that all of our services are absolutely free to everybody, and I'll outline a little bit later how we're actually able to do that. And like I said, we're an independent agency, and the reason that's important is we don't work for any of the insurance companies. Our employers are actually you, our clients. And because we're independent, we're not a one-size-fit-all shop like when you call the big insurance companies who try to sell you a product without knowing everything about you because they only have a couple of products to offer you. We represent all of the A-rated companies plus a lot of the smaller companies as well. And the first thing that we do with our clients before talking about any of the plans is we first want to make sure that they understand Medicare, what it is, what it isn't, what it covers, and what it doesn't cover. And then what we do after that is we begin by asking specific questions from our clients. And that's one of the things that the big insurance companies, when you call them directly, they don't start by asking you a lot of questions. What they do is they start to tell you about the features and the benefits of the product, trying to sell you that product. And because we're independent, what we want to get to know is about you, because we have access to all of the different programs that are available. And because of that, we want to get it drilled right down to what is specific. By asking you these questions, that's what sets us apart. We want to know who your doctor is. We want to know what prescriptions that you take, maybe any chronic conditions that you have. Because like I said, we got access to all of the different companies. And a lot of the times when you're talking with the insurance company directly and you tell them about your doctor and their plan doesn't accept the doctor, then what they want to do is have you change that doctor. Or you tell them about a particular prescription that you take, and they don't cover that prescription, they're going to want you to find an alternative prescription. So what we want to do is we want to find a plan that your doctor accepts and covers all of your prescriptions. And because we're independent, we're able to shop all of the different companies and help you find that very quickly. And when you're talking with a particular insurance company, you may tell them that you have a chronic condition like diabetes or COPD or anything else. Some companies actually have programs that are designed for some of the chronic conditions, and if you're talking to one particular insurance company and they don't have a program that is designed for diabetics, for example, then they're just going to want to provide you the best program that they say that they have in order to fit you into that program. We ask you questions about how often that you go to the doctor, what your general overall health is, because we're trying to discover what type of plan is going to best fit what your needs are. Maybe it's going to be a low premium plan that has higher deductibles and co-payments because you're relatively healthy or very healthy and don't use the doctor very often. Or maybe you're someone who has a chronic condition and might be going to the doctor a couple of times a week or at least 4 times a month. Then maybe a plan that has a higher premium with very low co-payments and very low deductibles might be best for you. Like I said, all of our services are absolutely free to you, and we don't make any money unless we provide you a plan. Yes, we are salespeople, but we don't have to do the selling in a traditional sense of the word. What we're able to do is we're able to educate and provide all of the different options. And then when somebody trusts us and they like our recommendation and they know that it's the best for them, then they go ahead and sign up through us. And that's how we make our living and how we pay our bill. We help you pick the plan that is right for you. Not what's right for the insurance companies, not what's right for your neighbor, not what's right for your spouse, but what's right for you. And we have many people call us who ask us to do a review of their insurance, and a lot of times I ask them, well, how did you pick the particular program? Well, my neighbor recommended it, or it's what my mom had or my spouse had. And we go through things and we find a particular program. Like I said, we ask them all of these questions that best fits their needs. So when you talk to your neighbor, keep in mind that that is a plan that is probably great for them, but you still want to do a lot of your research and make sure that you pick the plan that is correct for you, because the doctors that you see, the specialists that you see are likely different. In addition, the prescription drugs that you take are different. You know, you may take a lot of generics or you may take a few brand name drugs. All the companies, they all have different prices for these, and this is what you want to look at. We also get a lot of people who have picked their program from a volunteer that might be in a senior center or at the library, and we're not saying don't go see these people. Absolutely go see these people. I've talked with many of them, and they are well versed in Medicare. They give terrific recommendations. But you have to remember that when you're picking a program and who you're signing up from, if you get a recommendation from a volunteer and you go directly to the insurance company, remember that volunteer, I doubt that they're going to give you their personal cell phone number so you can send them a text. I doubt they're going to give you your email address, and you're going to want to have these things from an agent, because when you do have problems, and everybody has some type of problem with a claim on down the line with all the companies, or has a question, you have an advocate to ask, like us, and that's why we're here. So when you have that question about a claim, you have someone else besides the insurance company to talk to. All the time we get on the phone with the insurance company, sometimes a three-way phone call with a client trying to clear up a claim that isn't paid, trying to see why it wasn't paid. And when you have a third-party advocate like ourselves, we're able to do that for you. And the volunteers, like I said, they're fantastic. Absolutely go see them. They give you a lot of terrific information. But after you get that recommendation, you're not going to want to go directly to the insurance company you recommend. You're going to want to see an independent brokerage like ourselves, because these programs, they change every year. And then every year you can come to us and we can go through all of your situation, because it might have changed, and we can provide you with a new program that might be better fitting for you in the coming year. Again, my name is Chris Duncan. I run a company called Trusted Benefits Direct. You can find us at trustedbenefitsdirect.com, or you can simply reach us here at 800-910-3382. Thank you so much.